where Prime Minister Narendra Modi recently talked about the obesity epidemic that has gripped India in his monthly Mann Ki Baat radio broadcast. In his radio broadcast, PM cited WHO data and said that in 2022, around 250 crore people were overweight globally. He added that using less oil and deal with obesity is not just a matter of personal choice, but a responsibility towards one family. A day later, he now nominated 10 people of eminence from different walks of life to help strengthen the country's fight against obesity and spread awareness. This includes Infosys Foundation chairperson, author and Rajya Sabha MP Sudha Murthy ji, Infosys co-founder and former UIDAI chairman Nandan Nilekani, Mahindra Group chairperson Anand Mahindra, Jammu and Kashmir Chief Minister Omar Abdullah, Olympic winning shooter Manu Bhaker, actor and producer Mohan Lal, actor R. Madhavan, singer Shreya Ghoshal, and actor and BJP MP Nirua Hindustani. That's again, the big development that we are tracking at this point of time. Meanwhile, joining us at this point of time is Dr. Ishi Khosla, practicing clinical nutritionist, author of The Diet Doctor and the scientifically proven way to lose weight. Ma'am, thank you so much for joining us on NewsX, taking out time. My first question to you is, what is obesity? Who classifies as an obese person, and also, why is obesity cases, why are the cases rising so rapidly in India?
Well, first of all, I think it's a matter of great, I would say it's a great accomplishment from a Prime Minister from a perspective of a leader of a country to address this huge crisis. So that's absolutely, I would say, a step in the right direction and much needed. Obesity is becoming a huge problem and has been in the last, since the last, I think the last 2 decades, and continuing to grow despite the fact that we have been very aware and we've been taking measures. So defining obesity is simply having a BMI of more than 23 in the Indian context, in the Asian context, in the international context, a BMI of more than 25 kgs per meter square, which is really a ratio between your weight in kgs and your height in meters. And the other concern is not only the BMI, it's the where the fat is located, as we call it, central obesity or abdominal fat. Now, even though you may be, the BMI may be within the standards, but you still may have, storing fat in your visceral area, which can also lead to health problems. So obesity in itself is a risk in for health problems, but just having fat in the wrong place itself is inflammatory and can cause anything from diabetes, heart disease, to other metabolic problems and other problems. So essentially, I think the issue needs to be addressed, because in the backdrop of so much information, particularly with respect to nutrition and lifestyle, there are, we are not capping the epidemic, and it's growing rapidly, not only among adults, but among children.
Right, ma'am, absolutely. Now, 9 to 5 desk jobs are widely considered to contribute significantly to a sedentary lifestyle. How can one tackle that?
Yes, sitting is now called the new tobacco, and certainly we will need to address that. And simple things like getting up from your desk or from your chair to move around for 10 minutes or even 5 to 7 minutes every hour is a good idea to combat that. And then now we have the concept of standing desks, and of course regular physical activity and yoga and exercise, outdoor sports, etc. all will contribute to addressing this 9 to 5 sitting job. And I think these offices or workplaces also need to make these decisions and take these steps to help their workers to deal with this problem, because sitting is certainly adding huge risk to the weight issue.
Right, ma'am, absolutely. Now, let's also talk about children. Reports indicate that in 2022, 12.5 million children in India between ages of 5 to 19 were obese. The Prime Minister has, of course, always laid emphasis on the fact that the youth is the future of our country.
Yes, absolutely. And we are seeing children with, obesity, and even when at very high birth weights. Plus, the risk is that these the risk that we run is that these
Okay, all right. I think we've lost that connection over there, but again, that was Dr. Ishi Khosla sharing her perspectives on why there has been a surge in the number of obesity cases in India. Of course, there has been, there's in fact a fact and figure that we have over here for you as far as the level of obesity and the cases of obesity rise is concerned in the national capital, where as per WHO, the worldwide prevalence of obesity has nearly tripled between 1975 to 2016. So again, putting that into perspective, the Prime Minister's, of course, nominated 10 eminent personalities from all walks of life in, of course, putting into things into perspective, wanting to encourage people to choose the path of a healthy lifestyle. Of course, people are working 9 to 5 jobs, as we were just talking about. A lot of people sit on their tables, they're just working, and of course, to combat that as well. So again, those are the developments that we were tracking. We were in conversation with Dr. Ishi Khosla on NewsX. Of course, facts there on your screens at this point of time. I'm being told that ma'am is back with us on the broadcast. Ma'am, if you could please complete your thoughts there.
Yeah, who have the option to display themselves. And the funny part is,
are we able to get Dr. Ishi Khosla's connectivity on the broadcast? Of course, we were talking about, children. Ma'am, if you can hear me, we were of course talking about children and how there has been an increase in the number of obesity cases in children between 5 to 19 as well.
And this poses a huge risk to diabetes and to metabolic problems, high blood pressure, and several other hormonal problems and autoimmune issues, and even more serious issues, including mental health issues. So it is a whole, a whole bunch of lifestyle disorders that these children are at risk because of early obesity. And not only this, we are seeing reproductive issues and early menarche, precocious puberty in young girls, which means that their growth can be hampered. We cannot achieve full growth potential in such children. So both, when you look at the entire spectrum, it is posing a grave, health burden to the society, and early intervention is critical, absolutely critical, and the steps in the right direction need to be taken literally on a war footing.
Right, ma'am, and also just to talk about the root cause itself, is it the fact that, 10 years ago, people in India would not go out as much to eat food? Now it's become rather common to go out and perhaps get coffee or get dinner. Is that one of the main reasons why there has been an increase because of a lifestyle change?
The entire ecosystem that we are living in with respect to our food has changed so dramatically. Never before could we imagine getting a hamburger or a pizza at 2 o'clock in the morning. Today, with the food services and the apps that we have to get 24/7 food availability at the click of a button, is absolutely critical. And I see this in my patients. It has transformed eating habits. These foods are not only high in calories, in the wrong quality of calories, but in components which are addictive. And I have patients who have now admitted that this pleasure cycle, which comes from looking at a menu and deciding what to eat in the wee hours of the morning, gives them a high. It's a new pleasure activity. It seems like a dope. And it is very and I know they've gone on to record saying that we never did that, but ever since we've started doing this, ordering food from these various delivery apps, gives them a pleasure which is not about eating, but it's about the ordering. It's like retail therapy. So, yes, it is something which was unheard of and is contributing. Eating outside food, whether in restaurants or like ordering in, has changed the way we are, looking at food and not being able to manage our, despite the calories on every menu today or every package, knowledge is not translating into any form of change. And we need to get to the root cause, like you rightly said, and change the way, we're talking about food, eating more home cooked food, more simpler food, and looking at the gut. That is a big driver. And if we change, and actually, in my practice, I see transformations in short spans of time just by addressing the gut microbiome and eliminating trigger foods, trigger grains, and sugars and addictive foods can just make transformations in the eating behavior. So yes, root cause approach is needed. Simply and each individual needs a personalized diet today. It's like, that's another part of our conversation, that the time to customize diets rather than having mass recommendations and guidelines is needed. And I think we need to really work on this at a level which is now being done by Prime Minister Modi, and I would congratulate him for this very, very unique sort of intervention. And changing to millets also is a very big contributor, can really go a long way in addressing the microbiome and getting reducing the inflammation in the body, and moving towards resetting the system so that we can change our eating behavior. So it's about not only about fats, it's about having good fats. Not having the right kind of fat can also be a problem. So we need to introduce the good fats, remove the bad fats, and cut back, like he's saying, that reduce the fats. I think all fats are not bad. So reducing rather eliminating the bad fats, like the reused oils, the margarines, the vanaspatis, and all of those bakery fats should be removed and replaced by healthy fats for us to make that difference. And cutting back on carbohydrates, cutting back on the wrong grains, eating on time, all of these things can be done. And I think schools and our early intervention in life can make a big difference. And addressing this even before a woman gets pregnant, which means a pre-pregnancy diet and the pregnancy diet for the mother, can also go a long way in determining the body weight of a child later in life. So I think there's lots to be done, and good beginnings here.
Right, ma'am, absolutely. With that, I'd like to thank you for joining us on the broadcast, sharing your insights and perspectives with our viewers. On that note, we slip into a very short break. Thanks for watching.